The Minister for Health, Dr. Ruth Aceng, has taken spouses of heads of state in government delegations attending the 19th Non-Aligned Movement Summit on a guided tour of Mulago Specialized Women and Neonatal Hospital. They toured the radiation section, ultrasound room, CT scan room that focuses on detecting anomalies in unborn babies, the presidential suite, and the neonatal intensive care unit.
Of course, yeah, because I've seen something new. The kangaroo experience initiative, something that I think we are going to try and develop in our country, or something is a good innovation. And another also this urogynecologic station, also we don't have it. So I think we want to work also to do how can we do the same and have the same experiences.
We are very excited as a city, Kampala city, that we have a specialized women hospital, and I urge our women, come to this hospital, whether you're giving birth, whether you have illnesses of any kind. There is no need to go to neighboring countries. This hospital is one of the best in the region.
The spouses were also taken through specialties run in the hospitals like the fetal maternal medicine,
including the fetal maternal medicine, care for the very sick newborns who are as small as 500 grams. Also the urogynecological procedures that are done, the specialized imaging equipments that we have.
While delivering the speech of the First Lady, Kataha Museveni, Dr. Aceng said what is at Mulago Specialized Women and Neonatal Hospital is to be replicated in 18 regions across the country to take services closer to the people.
Fundamental issues that affect the productivity of health workers is motivation. And motivation is not only in terms of money, but also in ensuring that the environment that they work in is conducive, they have the necessary equipment, and they are empowered to do whatever they desire to do for the well-being of a patient. And the government of Uganda takes that issue very seriously. And many of you will recall that recently salaries were enhanced, and this will continue to be enhanced as the revenue base increases.
Despite achievements in reproductive health care and handling women with complex issues like pregnant mothers with cancer and carrying out constructive surgeries, the hospital has a challenge of human resource deficit that stands at 36.6%.
So really to offer that kind of service with a few human resources is quite a challenge. It brings burnout, it brings to delays in care. But also our patients sometimes may go out unsatisfied. However, the government is working on it. We are seeing an increment in wage in a stepwise part. So we are waiting to see that really our human resources up to that. We do have the equipment, we have the medical supplies. We need more human resource.
Dr. Gideon Mogisa, a gynecologist at the hospital, explains the new advanced surgical technology that has benefited patients.
That if you're going to work on a patient with a fibroid, with a cyst, for example, normally the normal surgery would be that you make an incision, which is about 15 centimeters. But with Minwax surgery, you are able to make a small incision about 1 centimeter. If I'm going to look in detail what I'm doing, I'll see better. Number two, there will be less blood loss for the patient. Also, you don't have your hands in the abdomen to touch many tissues. You have minimal touching of the tissue, so even the healing is better for the patient.
I'm Nafka Farida and Juman Samba.